Hi, I'm Jerry Brainum. I'm here to answer some questions submitted by viewers. So let's get to it right away with no further ado, as they say. The first question is, well, this is the question. It's going to be one question per video. Uh, Good day, Mr. Jerry Brainum. Could you do a Generation Iron video on tips for an overweight diabetic on how to get ripped in a safe manner? This is for my younger brother. He is type 2. Okay, that's good that he told me what type of diabetes his brother has, because there are two basic types of diabetes. One is called type 1 diabetes. Type 1 diabetes is usually the result of an autoimmune reaction, which involves the immune system attacking its own cells, attacking the cells in your own body, I should say. In this case, it would be the beta cells in the pancreas, also known as the Langerhans cells. These particular cells manufacture insulin. The actual causes of what initiates this immune reaction isn't really known. Some suspect that there's a certain type of protein in milk that can do it, but the true actual base cause is not known. The point, though, being that type 1 diabetics, Chip, that's my dog, type 1 diabetics must, because of the actual destruction of the beta cells and manufacture insulin inside the pancreas, they by necessity must take insulin injections. Uh, now, it doesn't limit you in bodybuilding. There was a Mr. America 1981 Tim Belknap who was a type 1 diabetic, and he successfully won, as I said, the Mr. America title in 1981. He also won the NAB and Miss Universe title. And Tim had to take insulin most of his, nearly, well, all of his life, actually. And he commented to me, by the way, when the insulin craze first started in bodybuilding, he commented to me that he was absolutely amazed that bodybuilders would be voluntarily injecting insulin who didn't have diabetes, since he considered having to inject insulin the bane of his existence. He hated doing it. But to get back to the question, the other type of diabetes is called type 2 or adult onset diabetes mellitus. It was called adult onset because it usually didn't appear until a person was about 40 years old. However, in recent years, it has shown up actually shown up in children as young as 12 years old, which they attribute to a lack of physical activity, sitting around, playing around with video games and on computers. The kids don't move as much today as they did years ago. And the secondary factor might be the ubiquitous nature of fructose, high fructose corn syrup, which is found in so many processed foods. These kids load it up. Now, if you're active and you're ingesting fructose, there's no real big problem with fructose because you're going to burn it off with the exercise. But if you're a sedentary kid who sits on his behind and plays video games all day and eats all these fructose-based candies, foods, and cereals and so forth, you're going to get obese, and you're going to create situations in the body which will result in early diabetes type 2, which normally, again, wouldn't happen until middle age. So let's get directly to the question. I just needed that preamble to explain the differences in the different types of diabetes. The type of diabetes that this person who asked me the question is referring to is the type 2 adult onset. This type 2 is strongly related to a number of factors. Among them are genetics. If you have somebody in your family that has type 2 diabetes, you have a much higher tendency to inherit that situation. The other main risk factor is having too much fat on your body. Obesity, as your fat cells or lipocytes enlarge, they tend to get insulin insensitive, and that's the first step towards type 2 diabetes. Insulin insensitivity, it's called. It's also called prediabetes, and eventually, unless you make some preemptive changes, such as exercising, going on a diet, attempting to lose weight, it will develop into full-blown type 2 diabetes. Okay, now, with all that out of the way, excuse me for my explanation, I just wanted to make it very clear so you'll understand what my recommendations. My actual recommendations, the man who asked this question, I assume it's a man. That's a big assumption, actually. It could be a woman. But anyway, let's say the questioner wanted to know the best diet for his brother who has type 2 diabetes to get ripped. Now, this is actually a simple answer. And the answer is very simple, is a low carbohydrate diet, but in several stages. The American Diabetes Association, for some strange reason, still recommends that diabetics eat a fairly high carbohydrate diet. Of course, that must be modified by the fact that the carbohydrates they recommended are not processed carbohydrates like high fructose corn syrup and simple sugars. They recommend high complex carbohydrates, which don't kick out as much insulin. However, my personal belief and my research shows that type 2 diabetics have a much easier time if they eliminate as much carbohydrates from their diet as possible, simply for the fact that when you're diabetic, your body can't handle carbohydrates properly. Why would you give carbohydrates to somebody whose body chemistry is antagonistic to sugars? I mean, it's like giving a heroin addict heroin to treat his drug addiction. It doesn't make any sense. So what I'd suggest for any diabetic, even person, whether it's a person bodybuilding or not, is to follow a low carbohydrate diet. Specifically, I would suggest starting on with what's known as a ketogenic low carbohydrate diet. A ketogenic low carbohydrate diet is classified as containing 20 grams of carbohydrate a day or less. In some cases, some people have no carbohydrates, but the limit on a ketogenic diet is 20 grams. And I have to warn you, for the first 2 or 3 weeks, a person who follows a ketogenic diet properly, which means very low carbohydrates, is going to feel terrible because most people, including diabetics, are sugar burners. Their body tends to burn sugar rather than fat. It takes about 3 weeks at least for the body to adjust to using fat as a primary source of energy rather than carbohydrate or sugar. So, if the person gets certain symptoms such as extreme weakness or tiredness or anything like that, it's usually due to loss of electrolytes or minerals that is due to the natural anti-diuretic nature of a ketogenic low-carb diet. Because what happens is when you go on these diets, you break down muscle glycogen, which is carbohydrate stored in muscle. Each gram of glycogen is stored with 2.7 grams of water. So you initially lose a lot of water. And along with that water, you also lose minerals. The minerals specifically being sodium, potassium, and magnesium. Now, I don't think you need to replace sodium because that's found naturally, and there's enough sodium in food where you shouldn't have a problem. But the two minerals that you really want to be concerned with are potassium and magnesium. So if you notice feelings of weakness or real tiredness or just a blah feeling, you might want to supplement some extra potassium and magnesium. Also, do not take the potassium alone. Always take it with meals, because when you take potassium alone, there's a weird effect that occurs where you could wind up actually retaining sodium. So always take potassium with meals, never take it alone. So that's the thing. Now, you want to follow this ketogenic diet, and that's your first stage. You want to, since it takes about 3 weeks to kick in, you want to follow it for about 6 to 7 weeks. And after about a month or so, you'll be in a full fat-burning mode. After about 6, 7 weeks or so, you could switch to a lower carbohydrate diet. Increase the carbohydrates to about 50 grams a day and stay on that for about another, let's say, 3 or 4 weeks. And then the third stage is the stage that you're going to stay in for, let's say, a couple of months until you reach your desired level of body fat. And that would be about 100 grams a day. And when I say 100 grams a day of carbohydrate, I'm talking about that's assuming that you're engaged in weight training and exercise. Because if you weren't, you'd have to stay at the 50 gram to really lose body fat. But you can have 100, even up to 120 grams a day if you're engaged in exercise. And it's important to gradually increase the carbohydrates. For another reason is because the big problem with low carbohydrate diets is the lack of fiber and the lack of certain nutrients called polyphenol antioxidants. But even most important is that vegetables provide food for what they call the intestinal microbiome. This is the intestinal bacteria. Very important for your health, very important for immune response. Too complicated to get into in this video, but the point to remember is you have to have vegetables to feed this microbiome. And you get the vegetables when in that third stage, when you go to the, let's say, 100 gram a day of carbohydrates. The carbohydrates you eat will be in the form of vegetables, such as cruciferous vegetables, broccoli, Brussels sprouts, cabbage. Those are very healthy. You can have a little bit of fruit. Don't go heavy on the fruit. It's a little bit higher in sugar. Concentrate on vegetables. If you follow this plan, if your brother follows this plan, and even if he is diabetic, he's going to find that he's going to be able to cut his diabetic medications down to about nothing as his body fat decreases. An alternative plan, and this is a little bit tougher, would be to employ something called intermittent fasting, which is maybe twice a week or so, up to 3 times a week. You don't consume any food for about 12 to 18 hours. You're not going to lose any muscle if you do it intermittently. In other words, if you just do it one day, then eat normally the next 2 days, and so on and so forth. But it actually also will help tremendously in controlling insulin, and it's particularly good for those who have diabetes. I've seen many case studies where people with diabetes who use the intermittent fasting technique actually were able to conquer diabetes. They didn't have diabetes anymore. They were able to get off all medications. I had a huge article on how to employ all types of fasting in my Applied Metabolics newsletter, which I strongly suggest you subscribe to at www.appliedmetabolics.com. I cover nutrition, exercise science, ergogenic aids, hormonal therapy, anti-aging, fat loss, and many other subjects. So thank you for living. Thank you for living. Well, yeah, thank you for living. It's not hard to talk to dead people. But anyway, the point is, have a good day. Thanks for listening is what I meant to say. And good luck. I feel that, believe it or not, some people will call me names for saying this, but I have to be honest with you. I think steroids should be legalized, but with a big proviso. The athletes need to be monitored. They need to be medically monitored to make sure that they're not slipping into dangerous territory as far as disease.